First up tonight, the country hits another grim milestone as deaths from an overdose hit a new record high. Good evening, everybody, and thanks for joining us right here for Eyewitness News at 11. I'm Mark Zinni.
And hi, everyone. I'm Erin Connolly. Today, the White House announced for the first time more than 100,000 people have died over a 12-month period from overdoses. And this news comes as Connecticut announced a plan to try and treat these substance abuse disorders. Channel 3 Eyewitness News reporter Erin Edwards is joining us live in the newsroom with all the details. Erin
and Mark, Governor Lamont announced today that for the first time ever, the state will receive federal funding to treat substance abuse disorders. And this comes as overdose deaths are on the rise across the country and here in our state.
So we're definitely seeing an increase, and I expect that's across the board.
Across the country, overdose deaths are on the rise. The CDC announcing today there were over 100,000 overdose deaths in the U.S. since last April. That's up 28% from the same period the year before. Dr. FREDRICK Dombrowski tells us he's also seen a steady rise of substance abuse right here in our state.
When I was working in methadone, 10 years ago, our caseloads were, in the 70s, but now we see caseloads up in the 90s and the 100s.
He explains there are several reasons for the rise, one being the growing fentanyl crisis.
The severity of fentanyl is it's like 2 milligrams or 2 grains of sand of fentanyl could potentially kill you.
Experts say drug use also spiked during the pandemic.
Bad thing about the pandemic was a lot of treatment centers were closed or limited in what they can provide, but drug dealers never close.
In Connecticut, additional resources are on the way to help with the problem. Today, the governor announced Connecticut has received federal funding for substance use disorder. He estimates a boost of $30 million in annual Medicaid funding. Governor Lamont says the money will provide residential care services and increase provider payment rates for those struggling with substance use disorder.
Many individuals may not have insurance, and therefore they may not seek treatment because they may not have the money. This additional funding allows people who may otherwise not be able to get treatment to allow to have access for treatment.
If you or someone you know is struggling with a substance use disorder, we have resources on how you can get help online and on our Channel 3 News app. Live in the newsroom, Erin Edwards, Channel 3 Eyewitness News.
Erin, thank you very much. Right now from Windsor.